Welcome to Back to Health. My name is Dr. Philip Corbin. Today we are talking about hypertension, and more specifically to that, what we are wanting to discuss is what cardiovascular health really means. Hypertension, as many are probably aware, is a very prevalent disorder and serious health condition that affects millions and millions of Americans every year. And we want to start to step back from that and understand really why it's occurring, what I can do about it, and how's it really going to affect me from overall health perspective. And so the first thing I would like to say before we get into any of this is by no means am I saying that all the things that we're going to speak of are the way you need to manage your high blood pressure. High blood pressure is a diagnosed condition by your doctor, and therefore it is up to them to determine how to help guide you along that process of how you're going to treat and understand that. But it is also your responsibility to yourself to understand what it really means to your overall health picture and how the things that you do greatly impact that ability to manage a situation of hypertension or high blood pressure. So first thing we're going to do is we're going to cover the anatomy of what's really going on when we talk about the cardiovascular system. Understand the anatomy as it applies to what controls the different aspects of the anatomy, and then we need to understand what it means to be hypertensive, and then what steps that you can take to help manage that situation. So what we're going to do is we're going to start to get into the anatomy. The cardiovascular system consists of the heart, lungs, the blood, the arteries, and the veins. And basically what you have is you have the heart that pumps everything through, the lungs that give us the oxygen into the blood that then the body is able to transport to the rest of the overall organism or our body itself, and then through the blood, and they do it through the tubes being the arteries and the veins. Specifically, when we look at the heart itself, we're talking about a specialized type of muscle cell. Cardiac muscle cell has its own specific type. It's unlike any other muscle in the body, and therefore has a specific function to contract and pump the blood through the body. It does so because it receives in deoxygenated blood from the superior and inferior vena cava. These go into the right atrium, which then goes down into the left atrium, and then from there it goes out through the pulmonary arteries into the lungs. Now this is an important process because it is through the lungs, when it goes through the arterioles and a very small surface area of space, it's able to transfer oxygen out of breathed air in through the lung tissue and into the blood, collected onto the heme of the blood itself. And then after it's oxygenated, the blood then flows back into the left atrium via the pulmonary veins, and then on the right and the left, and then it goes out through the aorta with the contraction of the left ventricle. And so at each pulse, as the pulse occurs, that is the entire process that's going on, the anatomy associated with that. So essentially the heart is nothing more than a muscle that is pumping through the system of tubes that we call arteries and veins. Now this is obviously under the control of the nervous system. This is done with the heart beats and contracts without our conscious basis, so therefore it falls under both the sympathetic and the parasympathetic side of the nervous system. This is our fight or flight mechanism that the body has. The nerves that supply this area initiate primarily out of the upper thoracic region. The sympathetic nerves innervate onto the SA, the AV, and the cardiac muscle itself, which this is how the body regulates how much pressure is needed. In the sympathetic situation, it's that fight or flight. It is that you have to have blood going to the muscles to be able to run away from a threat. Therefore, the body needs to contract more forcefully and send blood out into the periphery, dilate the vasculature so that it can get there more rapidly. And then on the parasympathetic side, it does just the opposite. It brings us back down. We kind of talk about this rest and digest. And these specialized nodes of tissue, the SA node, the AV node, and the cardiac muscle itself, have receptors there that control how fast and how forcefully the heart contracts. I mean, it's obviously a very in-depth process, but essentially that's all this organ is doing for us. It's falling under the nervous control of our lower brain, and then what our body demands of it is what the body responds to. So it will either forcefully contract harder to pump more through the system, or it slows it back down because of the demand is not so great. So this fundamental approach, you have to kind of go to the aspect of it all goes under the control of the brain. So you have the upper brain, which controls our conscious thought, but our lower brain, that's where, you know, our subconscious activities, heart rate, breathing, all of these aspects occur in the lower brain. And therefore, it starts off with the brain and then down through the spinal cord. These two areas that are innervated from that lower brain directly go into these areas to which we were speaking, where there are the nodes, the sinoatrial and the atrioventricular nodes. That's areas of the heart musculature internally that registers what is going on with the contraction aspect of the heart itself. Also in this area we have some baroreceptors. These are receptor sites inside of the arteries themselves that measure what the constituency of the blood is. Our body works in a very small pH window, and it works in a very small homeostatic window, particularly in association with the fluid. It does this through these baroreceptors. These specialized receptor sites in the blood measure what is the constituent nature of your blood. How viscous is it, or how thick? How many red blood cells, white blood cells, acid content. All of these factors are constantly being measured through these receptor sites particularly in the kidneys and in the carotid sinuses in the neck. The other intervention through the sympathetic side is through the lumbar and thoracic region, and this is specifically associated with the kidneys themselves and the adrenal glands, and these receptor sites then can stimulate through this endocrine system a change in blood pressure. So when we stop and we think about what is actually going on in the controlling mechanism of the anatomy of the body, is you have the heart that's pumping through these veins, arteries and veins, out through arteries, in through veins. And what it's doing is it's taking the oxygen it received from our lungs and it's distributing it out to the body. The oxygen, therefore, necessary for us to control all our metabolic processes. Muscular contraction, your ability to see what you need to, whether or not you need to understand if you need to eat or perform or walk or whatever your actions are actually going on, your basic need is all controlled through that need for oxygen. And then secondarily, for what energy sources that we start to require to meet those needs. And so this all falls under the control of the nervous system. As the blood goes through the system, it is constantly monitored to maintain this balance of effect. And therefore, the body wants to maintain a constant pressure through these tubes. And that is very important to understand, is that pressure difference can only be controlled in two ways. You either can increase or decrease the amount of force that the heart itself is pushing the blood through the body. That muscle is the only thing in there that's actually moving it through the system. You're assisted with muscular contractions in the venules, particularly in the lower leg, to return it, but the actual pressure gradient inside of the system itself is measured in how much that heart contracts and can pump blood through the system. The other limiting factor is the diameter of the vessels to which it's going. Just as if you squeeze a water hose through a spout and it sprays farther, if you open it off and it flows through it, that's controlling the pressure. So all you're doing in that situation is you're taking a hose and you're making it smaller. The same thing occurs in our body, particularly in the arterial walls. There's muscular bands which surround these arteries, and it allows it to either dilate or contract to constantly maintain that control of the blood pressure. So that is what the blood pressure itself is. It's controlled by the nervous system from the lower brain. Your body does one of two things. It either increases or decreases the forceful nature or the rapidity of the heart contraction, or it reduces or increases the size of the tubes through which that is going. And the only other aspect that can play into that is the viscosity, to which we spoke earlier, and that is the thickness of the blood itself. And that is regulated through the kidneys through either drawing out water or allowing water to remain in the blood itself. So that's how our body maintains this nature. So this is a constantly evolving thing that occurs all the time naturally in our body. The problem occurs is when this pressure becomes too high too often. And that is a condition we call hypertension. And that is a serious health concern because then you have a greater demand upon the entire system. And as we're already starting to understand, it's very important for this system to be functioning properly so that our body gets the oxygen we need. So hypertension, blood pressure is the force applied against the walls of the arteries as the heart pumps blood through the body. The pressure is determined by the force and the amount of blood pumped and the size and flexibilities of the arteries. So here's a diagrammatic explanation to what we were just referring to. The little platelets inside there would relate us to the viscosity of the liquid going through there, which is our blood. Blood pressure readings are millimeters of mercury. Typical example is 120/80. One or both of these numbers can be high, but 120/80 is basically our gold standard blood pressure reading we would love to see in all people at all phases of their life after about age 14. The top number is your systolic pressure. It's considered high if it's over 140. Most of the time it needs to be at or below 120. Hypertension, the bottom number is your diastolic pressure. It's considered high if it's over 90 most of the time. Normal is 80 or below. Pre-hypertension would be considered if your top number, your systolic pressure, is between 120 and 139 most of the time, or if your diastolic pressure is between 80 and 89 most of the time. So in other words, both this systolic outflow or the diastolic, the maintaining pressure as the heart refills, if these numbers are 10 millimeter of mercury or in that range between change, we consider this pre-hypertensive or essential hypertension, to where a person then is diagnosed with having hypertension. So this then becomes where a person has to start to make some decisions for themselves about why this is occurring. Because ultimately you really only have your interventions then start to be predicated about what you're willing to do for yourself from this point. But once we understand it, it's at that change where we consider it hypertensive, now we can start to understand what it means to manage it. If it gets outside of this, I would say, strictly, you're a strict medical condition. Many factors can affect the cause of blood pressure. How much water and salt is a big factor. And the conditioning of your kidneys, nervous system, and blood vessels, however, really is an indicative nature of the water and salinity in your body. The levels of different body hormones also act upon this. You're more likely to be told your blood pressure is too high as you get older. That's because the blood vessels become stiffer. There's less elasticity inside of the tube through which the blood is moving. When this happens, the pressure goes up. It's the same thing as that tube not being able to expand. So therefore, you increase your chance of having stroke, heart attack, heart failure, kidney disease, or even early death. So obviously, these are some serious ramifications for having these changes occurring chronically. Some risk factors associated with hypertension or having high blood pressure is age and sex. Most cases of high blood pressure are diagnosed in men until about the age of 45. At 45, then it starts to even out and either shift more toward women. From age 45 to 54, men and women are about equal, and after age 54, women are actually more prevalent. Family history is a big determining factor as well. It does not mean that just because your dad and your dad's dad and your dad's dad had high blood pressure that you are by all means going to have high blood pressure. It means that you are going to have a more opportunistic chance of getting it if you follow the same patterns through which your parents did, meaning diet, exercise, and lifestyle choices, which we'll get into a little bit further on. Ethnicity is one thing that is particularly African Americans and Native Americans have a higher incident rate of high blood pressure than the rest of the population as a whole. Compared with Caucasians, African Americans develop hypertension earlier in life. Their average blood pressures are much higher. Hispanics have a higher ratio of diabetes and obesity compared with Caucasians and have a lot more of the risk factors involved for hypertension. But essentially, we know that African Americans and Hispanics tend to have a higher incidence rate than Caucasians do. Diet. Diet is a huge contributing factor. People who regularly eat foods that are high in salt and they're more susceptible to high blood pressure. Also, we're finding more and more that it's not just the sodium content associated with the foods we eat, but a lot of factors involved in how we eat, the things that if it's fried or prepared, those types of aspects, what the fat contents are. That tends to really influence not just what content we ingest, but also what our body is able to retain or eliminate effectively. So there's a lot more to it than just how much salt is on your eggs. Obesity, again, another risk factor that is hugely responsible for an increase in hypertension. The reason for this is we spoke about how the body has an overall demand of oxygen. The bigger you are obesity-wise, that means you are having to maintain all those extra cells. Those things have a cellular caloric need that has to be met, and that caloric need has an oxygen expense. So a person who is obese has an overall caloric need, an overall greater oxygen demand. Therefore, they are continuously needing that pumping mechanism to be functioning at a higher rate, even at rest. Add that to the fact that gravity then plays into effect your ability to move, and usually to become obese, you've eaten a lot of these products, so then it becomes a catch-22, a cascading events that tends to perpetuate this hypertensive state. Stress is also something that is shown to be a major risk factor. People that are heightened anxiety, intense anger, suppressed expression of anger are more at risk of developing high blood pressure. The body does not recognize stress in any other way than it is stress. Be it good stress, bad stress, or whatever, it is stress, and there's a specific response that we talked about in some earlier shows. But we need to understand that that's another area to which we can start to take responsibility. The excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels as well as the organs in your body, particularly the heart and the kidneys, which are big issues particularly associated with further systemic problems such as diabetes. So all of these things do play a concomitant role, or they play upon each other. And so the higher your blood pressure, the longer uncontrolled, the greater the damage that's going to be going on. Uncontrolled high blood pressure can lead to heart attack or stroke, aneurysm, heart failure, weakened and narrow blood vessels in your kidneys, thickened or narrowed or torn blood vessels in your eyes, metabolic syndrome because your body is not able to move its different metabolic waste products in and out of itself effectively, trouble with your memory even, or understanding. All of these are tied into having a chronic hypertensive state. So when you're diagnosed with hypertension and you're in the medical setting, the first thing they're going to start to consider is, should this person be put upon medication intervention? There are specific medications that are associated with these processes in the anatomy to which we spoke earlier that they can then start to address. And we'll go through these in a minute. But basically what we're trying to do through pharmacological intervention is you're either trying to increase or decrease the diameter of those arteries and veins. You're either trying to increase or decrease the pressure through which the heart contracts and the force through which it puts through the system, or you're either trying to increase or decrease the amount of fluid or water in the system. So it goes back to those three aspects of controlling that pressure system. Medications that a medical doctor would consider would be diuretics, and that controls the water. Beta blockers, this controls epinephrine and norepinephrine. That's also in the adrenal glands, and that affects overall heart contractility and force is specifically related to the presence of epinephrine or norepinephrine. Angiotensin converting enzyme or ACE inhibitors. These are angiotensin is an enzyme inside of the blood vessels, and it makes the arteries either contract or relax. And this enzyme has to be present for angiotensin 1 to turn to angiotensin 2 or vice versa. But that's not important. The point is, when you take an angiotensin inhibitor, it reduces the effectiveness of this enzyme in your body, a naturally occurring process. So we're altering that, and we're trying to get a resultant effect of having the vessels increase in their diameter, reducing blood pressure from that aspect. Angiotensin 2 receptor blockers, same mechanism, except instead of working at the enzymatic level, it's trying to actually keep the body from taking in these markers that we're supposed to take in and manage effectively. Calcium channel blockers, same scenario. Renin inhibitors, that's specifically associated with constituencies in the kidneys themselves. This is then there's how you deal with it from a medication standpoint. You put a pill in your mouth and you take this accordingly so that you try to reduce your blood pressure consistently so that it gets back into those normal ranges. This is a highly effective way to do this. Each and every one of these medications carries with it a side effect that can be simple things to live with, but then we'll have further health concerns down the road, particularly if you start this earlier in life, particularly in your 40s or 50s. Then you can start to consider that you're going to live until 70 or 80 years old, and you're going to do this for as much as 30 years. Then you can start to understand how this approach might be something to maybe be hesitant in getting into. What you can do is you can eat a heart-healthy diet, including potassium and fiber, and you can drink plenty of water. That essentially, then you're controlling that constituent aspect of what you're putting into your system. You can exercise regularly, at least 30 minutes a day. We're going to get into these aspects here in just a minute, but these are the two things that you can have the most specific impact upon if first and foremost you understand that your health changing actually occurs with you and not with the prescription or the diagnosis. You can, if you smoke, quit. Find a program that'll help you stop. Limit how much alcohol you drink. 1 drink a day for women or 2 a day for men. And we're even finding that, there are some studies that show a regular, small, moderated doses can be beneficial, but let's err on the side of caution and try to give ourselves real limited and controlling in these aspects. It's really about moderation in all of the aspects of how we would intervene with these ways. Limit your amount of sodium or salt that you eat. Aim for less than 1,500 milligrams per day. Reduce your stress. Try to avoid things that cause stress for you. You can also try meditation, yoga, anything that you need to do. Exercise can help you reduce that stress. Stay at a healthy body weight. As we were speaking to earlier, that weight has a direct relationship on the demand of the system. So if your body weight continuously stays high, you need to consider if we can't drop that down, your overall caloric need reduces, and then also your overall oxygen demand is decreased. So that is something that we can really start to look at. Specifically, when we get into what we can do, the 2 primary things that we've been speaking of are exercise and diet. So, to diet, the main aspect, we've talked the entire show about anti-inflammatory diet, specifically looking at fruits, vegetables, lean meats, things that we can either hunt or gather, and stay away from things that are processed on a further level, grains, things that are processed and further fried and things like that. So that is a whole topic in and of itself. And there is a lot of information, and I will steer people more toward that program, which we have on our website, and you can also call the station here and have them get a copy to you. But specifically to exercise, what you can do is you can get out and do that 30 minutes a day, of which we spoke earlier. Now that's important to consider, because what you need is doesn't mean that if you haven't been doing any of these, there's a whole process to go through into getting started. But you start small and you have a cumulative effect over the day. Ultimately, you would like to be able to do one continuous bout of exercise or activity for 30 continuous minutes. And that's important because what that does inside of our body is that allows our body to, in a natural way, increase the pressure and the need of the heart to pump. It allows the systemic restriction of the arteries to open up and allow that blood flow out to the musculature. And then the musculature contraction in an effective and healthy way is able to effectively return that to the heart and allowing it to do its normal God-given thing that it is supposed to do. It reduces specifically the constituent products. It changes the profile of the constituent products of the bloodstream itself, going back to those baroreceptors and things that we spoke of in the kidneys and the carotid sinuses. And then our body is able to more effectively manage that hypertensive state, and it does it in an effective and natural way. And the more consistently you do that and draw that neurological, sympathetic, under your conscious control thought to that, your body becomes more efficient at doing it at all times. So the benefit not only occurs while you're exercising, but also throughout the rest of your day. So that is the whole thing. And again, we've talked about episodes about walking and other exercising things. Please, feel free to look into those as well. But specifically, as a chiropractor, we also can affect a person's blood pressure. And there was a recent study in the Journal of Hypertension, a medical journal, which showed that a specific chiropractic technique called NUCA, or the National Upper Cervical Chiropractic Association, and their technique focuses specifically to the upper cervical region. And the reason that we're finding that this actually has a positive effect on the management of hypertension is that upon impacting a alignment correction into the upper cervical region, we find that the neurological response on the cranial nerves that we talked to in the anatomy earlier allows the same resultant effect as the medication would do in allowing for either contraction or dilation of the arteries and veins, and an increase or decrease appropriately associated with the heart forcefulness as well. So these aspects can be absolutely impactful. At the point of being hypertensive, you may not be able to return it back to that point. If it's in its early stages, these are things to start to consider. The other aspect is the aspect of wear in the upper thoracic and the lower thoracic and upper lumbar regions, where the spine and the spinal tract have an innervation through those areas and joints of the body. You can effectively create a more hospitable environment for that nerve to be able to exist, and therefore the body will be able to communicate more effectively, either to upregulate or downregulate the appropriate areas that need to be dealt with, i.e. the heart, the kidneys, and the venules, and the veins and arteries themselves. So when we stop and think about hypertension, it's an extremely significant problematic health concern in our society. In daily basis, the people that enter my office, of the people over the age of 60, I would say at least 50% or more are on some sort of standard protocol, blood pressure modification, medication intervention. It doesn't make it wrong, it just makes it perhaps poorly informed. If you are on the early onsets of having a consistent high blood pressure, but you're in these lower levels, 122/85, 130/190, and it's more in that lower scale, you definitely maybe need to stop and self-check yourself. Am I overweight? Am I sedentary? Am I eating the wrong things? And how have I maintained the health and integrity of my spine and my nervous system associated with it directly? You can have an enormous impact upon your overall health picture if you will stop and consider why your body is in the condition that it is in and be real about what the answers are and what responsibility do you have for why it is in that condition. You have an amazing ability to control your health picture if you choose to take the steps appropriately. There is always a point of no return. If if it's degenerated past the point where your body can reclaim it, limitations of matter dictate that it will not return to its original state. But most of us get into these situations, and we know this information early on, and yet many times the smoker continues to not smoke, or the person who is obese does not take any changes to their diet or exercise plan. So we are responsible for our health condition, and therefore it's imparted upon you to be responsible. And that's how we can then truly reform our healthcare system. Today we've talked about some very in-depth information about hypertension, how the anatomy in our body controls this, and how it's managed through traditional and some untraditional methods. The more untraditional methods are starting to become more and more prevalent. More and more people are understanding these things and not so fearful of that understanding. I invite you please to contact my office or go to our website for further information about these types of topics, or information about how we approach it inside of our office. I'm Dr. Philip Corbin. This has been Back to Health. Thank you very much.